Hi, my name's Dr. David Garley. I'm from the Better Sleep Clinic and I'd like to explain a little bit about obstructive sleep apnea. So obstructive sleep apnea is a sleep disorder where your airway repeatedly closes when you sleep. Now, I think this sometimes needs a bit of explaining. So your upper airway is made of either hard structures like your hard palate, which is the bony bit found in the roof of your mouth, and soft structures like the back of the throat and the base of the tongue. Now, hard structures stay in place by themselves, but soft structures are held in place by muscles. And the issue is that as you fall asleep, your muscles relax. And so with the upper airway, as your muscles relax, it just narrows in on itself. Now, initially what this causes is turbulent airflow. This makes the soft structures vibrate, which we hear as snoring. Then in obstructive sleep apnea, what happens is the airway just narrows in more and more until it actually closes and you can't breathe anymore. I sometimes think this is quite similar to if ever you've seen someone fall asleep on a train, because they always seem to fall asleep in the same way, that they're upright, and then as they fall asleep, the muscles at the back of the neck relax and can't support the weight of the head anymore, so their head just starts to bob like this. And it's actually exactly the same in sleep apnea, that your airway just narrows and narrows, and your snoring gets louder and louder until the airway closes, and then you can't breathe anymore. You get this pause in your breathing. Now, when you're not breathing, your oxygen levels are dropping. And your body can only tolerate this for so long before it gets so concerned that it actually has to wake you up and pull you back from that deeper state of sleep to a shallower state, so your airway muscles regain their tone, pull open your airway, and you can breathe again. And this often restarts with a loud snort. And so this gives rise to the daytime symptoms of obstructive sleep apnea. So this is excessive daytime sleepiness. You might fall asleep in meetings, you might fall asleep when you're driving, you have poor memory, poor focus. But when this happens for months or years or even decades, this is associated with the development of a significant number of physical and mental health problems, including high blood pressure, stroke, heart attack, diabetes and depression. If you want to find out more about obstructive sleep apnea, we've got loads of resources on our website, and you can also email us at info@thebettersleepclinic.co.uk. Thanks very much.